Today's video will be a Q&A answering all your questions pertaining to the master's program for SLPs. So what's the first step? Obviously you need to go online to the master's program that you're looking into and see what their requirements are. So do you need a GRE, your application, letters of recommendation, and your letter of intent is usually what you need in order to get into the master's program along with those prereqs. Before applying to grad school, I'm required to get a certificate. Is this asked for by most programs? So again, that certificate is probably your prerequisite courses that you need in order to get into the master's program. So like I've stated before, either you get your undergraduate degree in communication science disorders, which those prereqs are in there, or you gotta take them in between your BA and your master's in that certificate course and get all of those prereqs, or your master's program offers them within the actual program. How many schools should I apply to? I suggest applying to as many as you possibly can that are available in your area. Also, if you're willing to go out of state, apply to universities out of state. However, take into consideration the pricing. Is pricing, going to make or break your choice of university? Does going to the same school for undergrad and master's program give you an advantage? I think it would give you an upper hand because maybe you would get letters of recommendations from professors that taught those prereq courses that are also in the master's program. Next question, who to get letter of rec from? Think about somebody that's going to help you get into that master's program. Is it maybe a clinic that you volunteered in? Is it a professor that you have good rapport in? I suggest that you build rapport with professors over the course of your time at that university, and then the ones that you build relationships with should be the ones writing those letters. What's a highlight in your resume when applying? So I would really highlight moments or experiences in your life that really make you different and what would make you an eligible candidate for that master's program, and how you would be more personable if you were accepted, and how to treat patients. So, it could be, for me, I really highlighted my sibling who has ASD. I was the only one applying in the program at the time with a sibling with ASD. How expensive was grad school? Super expensive. Were you concerned about student loans? So, no, I really wasn't concerned about student loans because it is what it is. In order to get your master's program is expensive. How are you going to pay for it? Student loans, or are you going to do a payment plan with the university, which still was super expensive and I couldn't afford at the time. So I had no choice but to take student loans out. And again, it is what it is. You pay it when you pay it, and there's nothing that you can do about it. It's expensive unless, you're super fortunate enough and your family put money aside for you and they're going to pay for your master's program. How many years to become an SLP? So let's forget about your BA. Did your BA however long. Typically, a master's program is between 2.5 years to 3 years. That's how long it takes you to become an SLP. Then after you graduate, you have your clinical fellowship. But to graduate, it is typically 3 years. How did you study and stay organized? So I would study by reading, writing. I really would write it over and over and over again. I'm not somebody who could just read it one time and memorize it, unfortunately. So I had to read it a bunch of times, write it a bunch of times, and I would even record myself reading the notes, and then I would listen to them in the car all the time. Did you have to work? So I only worked maybe the first year, and then after that it was just balancing this coursework, the studying, the clinic rotations. It was a lot. And in my program, I remember in orientation, they really push you not to work. How challenging would it be to still work part-time while in grad school, especially the first year? So the first year is just coursework. So I think it's totally manageable. That's what I did. My first year of grad school was just coursework, so test taking, and it was manageable, especially if your job is maybe at an office where you kind of can study and do some of your projects while you're working, then go ahead. How to balance life versus school. So if you stay organized and when you get those syllabi, you literally write everything down and you plan accordingly. Don't wait till the day before the test to study. Study a week out. If you have a project, do the project a few weeks in advance so that you don't feel overwhelmed. And that's what I did. So my program was Monday through Thursday, evening classes. When we started doing clinic, my university had an in-house clinic, and it would be clinic during the day, then classes at night. Friday I had off, so Friday I would utilize to really organize myself, plan for the next week, and the weekends I did not, literally Friday, midday and on, I didn't worry about school. So how many classes did I take per semester? I took max 3 courses a semester. And then when it came to clinics, then I would balance clinic. So again, clinic, my university had an in-house clinic, and we would do clinic during the day and then classes in the evening. Classes were at 5 o'clock. If I don't have A's in grad school, will it hurt my job prospect? Absolutely not. On your master's degree, it does not state your GPA. When you go for a job interview, they will not ask you what your GPA is, in my personal experience. So I went to multiple job interviews. Nobody asked me what was my GPA. So what to buy for grad school? So hands down, you're gonna need a computer. Specifically, I would recommend a laptop because you can take notes while you're in class. Most courses, the professor will upload already the lesson of the day via PowerPoints, and then you can just go ahead and add your notes to each PowerPoint. You're going to need a planner, whether or not you're techie and you like an iPad, you use an iCalendar, or you're like me and you like using an actual planner, and then you're going to need some sort of cute bag to carry all your stuff in. Did you buy all of your textbooks? Do you still use them as a working SLP? Did I buy all of my textbooks? Yes, I bought all of my textbooks. Did I rent some of my textbooks? Yes, so I bought all of my textbooks, and then at the end of the semester I would sell them back because I needed the money. I think I kept a few of them, and every once in a while I'll review and I will use them as resources. Did you do a bilingual specialization along with your master's? No. So what makes me a bilingual SLP is that I'm fluent verbally, so expressively, and I'm able to write and read in Spanish. I'm able to translate anything into Spanish for the caregivers and for the patients. So that's what makes me a bilingual SLP. You have to be fluent in both languages in order to be considered bilingual. When to look for externship placements. So you should look for externship placements at the end. My program did not let me pick or start looking. They had it all figured out. They have a plan of study. They will tell you when it's time for you to look into your externships, and most likely they will place you. So again, my university placed me. I didn't have a choice, and it was the last semester of the master's program. How to prep for clinical externships. So clinical externships, again, is something that you do towards the end of your master's program, and in my case, it was 2 rotations. So one rotation was in a pediatric private clinic, and then the second rotation was at a skilled nursing facility. So once you're placed and you know where you're going, do your research, go back to the classes and the notes that are going to help you with that setting. The majority of the settings will allow you to come in and observe for a few days. I asked for a week. I observed, I saw the treatment methods that my supervisor utilized, and then I did the same thing. So you learn by watching, you learn by observation, and that's how I did it. Of course, you're going to make mistakes, but that's why the supervisor is there. She's there to help you. And what's great is the supervisor's sitting in the session. So at any given time, if you feel that you're stuck, be honest. Don't just freak out and throw everything in the air and cry and run out. Stop what you're doing and turn to the supervisor and say, I need help with this activity. I'm not getting the response that I intended from the patient. What can I do? Now for your adult externship, do the same thing. Do your research. Where are you going? What setting? Look it up. Be familiar with your supervisor prior. Observe and be prepared. Be prepared as possible and read up. Don't go there just be like, hey, I'm here. No. When is the best time to take the PRAXIS? So some universities require for you to take the PRAXIS within the master's program, and you cannot graduate until you pass the PRAXIS. Nova did not require that. So I graduated and then I took the PRAXIS. So how did I pass the PRAXIS? There is a huge purple book. Let me look it up. Hold on. Okay, yeah. Okay, so the book that I used, and I think everybody and their mother used to study for the PRAXIS, is called An Advanced Review of Speech Language Pathology. It was purpley blue. No, the one that I used was like blue and green. I think now it's yellow and purple, and it's $125 on Amazon. So my university offered a course that it was mandatory. You had to take the course, and every week you had mock testing. So that helped you prepare for the time constraints, and it just helped you prep. So every week we had mock testing. We had that book. I think we had another resource that we utilized to study. But a group of us created a study guide for each chapter. So I had the book and I had the study guide. And what I did is I broke that study guide down by like 3 pages a day so I didn't feel overwhelmed. And I made sure that I really memorized those 3 pages that day. And then I would go into the next 3 pages and I would briefly review the last 3 pages. And I started studying for the PRAXIS, I believe like 3 months to 2 months out from my testing date. How does taking the PRAXIS and applying for certification work? ASHA's site confused me. So ASHA is the one who requires for you to pass the PRAXIS exam, your boards, okay? So if you want to earn your C's from ASHA, you need to pass the PRAXIS. Thank you guys so much for watching. Don't forget to like and hit that subscribe button. Bye, see you guys next time.